Thank you, Chair. Professor, earlier in the year, I asked the Secretary of State around support for those with disabilities, in particular hearing disabilities and those who are deaf, who've been having to use a charity-based app to be able to access certain care. I believe that's being supported from December through March, but there's no guarantees of that further than that. And I just wanted to get your sense of what research and what evidence has there been in terms of the impact on the deaf community in terms of accessing services, especially where they've needed to be reliant upon phone calls, for example, and also what the longer term plan is for that, because as we look into vaccine rollout and testing, it's going to be absolutely critical that the deaf community can access healthcare the same as everyone else in the population.
Thank you. I'm afraid I do not have the information that you require on that, and so I'll provide a written response later. Thank you.
Okay, if you could, I'd appreciate that. Thank you. My next question was just around the observatory generally. I'd just be keen to understand what the long-term plans are. I appreciate, there's challenges at the moment. Over the next 6 months, what are the biggest challenges, but what's the long-term goal? What's the outcomes that you really want to achieve through it?
Thank you, Dean. Well, the first thing to say, I guess, is that there is an urgency of a focus on COVID-19, but also looking ahead in terms of the medium to longer term things that we can put in place to have a positive impact on reducing the health inequalities that we see for our ethnic minority communities. We are establishing ourselves, but also at the moment focusing on the vaccine and looking at what is it that we can do to, as I highlighted before, highlight the effectiveness and safety of the vaccines, look at dispelling misinformation and mistrust so that people can be well informed to make informed decisions around the vaccine. Also looking at maternity health and, of course, the maternal mortality rates, which are higher amongst Black women, for example, and looking at mental health as well. The observatory will do 3 things. Firstly, it will bring together research, evidence, and rapid reviews. It will then turn that into actionable insight and recommendations for the system. And thirdly, it will help and support the system to implement those recommendations on the ground. It is an observatory, so yes, it will be observing, but it's not passive in its function. It will be a proactive investigator that will really, look at the deep-rooted issues that we have within our health system and within society as a whole in order to transform the issues that we see with regards to health inequalities. And it will do that in collaboration with other organizations going forward.
Thank you.